This is Nasha Kasha, Ukrainian Almanac. I'm your reporter, Stefan Andrusiak. March 29th, 2020, I set out to collect the voices of friends working at the heart of the pandemic. My first text was to a paramedic, only to learn that the first responder was himself a patient.
My name is Andriy Olenets. I'm a paramedic, and I work in Rockland County, New York. A few weeks ago, I returned from vacation just as the coronavirus pandemic was starting to make itself evident in the New York area. When I came to work, the nervousness among healthcare workers was more than palpable. Our calls for service were no longer those for typical heart attacks, strokes, or typical calls for injuries. Early in the evenings, our call volume had dropped significantly, but then once midnight rolled around into the morning hours, we started receiving more and more calls for people with flu-like symptoms, COVID-19 type of complaints, people who perhaps were not seriously ill, but were scared that they may have caught the virus, and they were hoping to be taken to the hospital to be tested. It was our job to try and filter out those patients that truly required to be seen in a hospital from those patients who were just seeking reassurance and were best cared for at home. But people were genuinely scared, and this was obvious. During this week, there was a new normal for us as we donned personal protective equipment for every dispatch, regardless of the nature. That meant an N95 mask, eye protection, gloves, things that we were used to, but only occasionally. I realized that I would be placed at a higher risk than I was previously accustomed to, so I was always very careful about protecting myself and protecting my partner. The week went by. As the nights got busier, I made sure to go home and rest between shifts. I wanted to keep my immune system strong. But lo and behold, on Friday, a couple of weeks ago, after my last shift, I was driving home and I became acutely aware of a feeling of weakness, as if something was coming on. I went to bed that night with chills, and the following morning, I woke up with a fever of about 39.5 Celsius. I started treating myself at home with Tylenol for the fever and tried resting and hydrating as best I could. On Monday, I went to go see my physician, and I was tested for COVID. From that point on, I laid at home, overdosing on internet, Facebook, and television, and tried finding any and all information about the virus and about its effect on New York City. I spoke with my colleagues who said that the call volume was crazy and that most of the calls now were for COVID-related complaints. The emergency departments have turned into something out of a movie. Every single staff member fully gowned, fully masked, fully gloved up. Laying at home and watching this was frustrating to me on a few levels, partially because I couldn't be with my colleagues and I couldn't be part of the effort to help. The other frustrating aspect of it was, where did I get it? Did I get it from a patient? Did I touch something and then touch my face? Or did I get it when I went to Walmart to buy groceries? I guess that'll never be known. Another concern was, oh my God, did I inadvertently infect someone close to me, or perhaps someone I don't even know? It took about a week to get the results, but I was pretty sure I had it. My cough was becoming worse. It's kind of like a dry, hacking cough where you're trying to achieve something deep in your lungs, but you just can't reach it. And the coughing becomes so dramatic that I could feel my kidneys shake and my intercostal muscles in my chest were starting to hurt. But I'm thankful it was no worse than that. I really did not have other respiratory symptoms. I wasn't short of breath, and thank God I didn't require hospitalization, but I could just take care of myself at home. I'm extremely thankful for the support from my wife, from my neighbors, and even from people from far away who just sent me wishes to get well. I believe all of these things help a person recover and help a person survive the solitude of isolation. Today my fever is improved, but my physician still wants to rule out that I didn't contract pneumonia during this episode. I'm hoping the coughing will subside, and I hope soon to be able to return to work and be with my colleagues. If you think this can't affect you, you're wrong. This is affecting the young, the old. This is affecting those with comorbidities, such as diabetes and heart problems, but it's also affecting those that are perfectly healthy. Thankfully, I'm on the road to recovery, but I tell you, I don't wish this upon anybody. Social distancing has been repeated so many times, it's now become cliche. But all I can say is, it's no joke. Take it seriously, because it truly will save lives. It might save yours, it might save a loved one's, and it might save someone you don't even know.
We'll hear from Андрій again at the end of the show.
Тримай свою хвилю, гриби свою милю, не думай про гроші, не слухай про гриб. 5000 спилось, 200 втопилося, ти ще живий, тільки голос захрип. Не все так погано, є марихуана, брикети пуер, хоч тютюн на здогін. А ти ніби гриб, посміхаєшся зверху, ламай свій власний силу в собі. Гриби свою пісню, живи легковісно, важке ні до рук, ані до голови. Похиряй проблеми, висавши у темі, і в темпі хорошому просто живи. Живи, люби, полюбити так мило, лети і кохай.
The band Kozak System from Ukraine, entreating us to live and love, because to do so is sacred.
Good morning. My name is Irina Kit. I am a registered nurse working in New York City. I've been working as a nurse for the past 4 years, and the past year and a half I've been working as something called a float nurse. That means that I never know where I'm going to be floated to. So there's about 30 units in our hospital, one of the biggest New York City hospitals. And I come in, and basically 5 minutes before my shift starts, at 7 o'clock, I'm told where I go. Sometimes 2 hours into my shift, I can also be floated off. Over the past year and a half, I've gotten really good at being flexible, handling the unexpected. And I really feel for all of the medical workers, including nurses right now in this pandemic, because I know to them this is all new. To them being thrown into a different unit because there's a lot of reshuffling and organic kind of moving of equipment and personnel and everything. It's quite new, so I've never been more stressed or exhausted than the past 2 weeks, even being a float nurse and thinking that I'm prepared for everything. Currently, my day is from 7 a.m. to 7 p.m., but I leave most of the days probably by 8:30, because there are different codes and things to do. So we see a lot of hope. We see a lot of frustrating feelings. We see people when they're at their most vulnerable. And the reason that this current COVID crisis makes it more difficult for us, because this is something that we're trained for, right? This is something that we went to nursing school for. This is something that we have compassion for, is because I know everybody's trying to have minimal exposure, but nurses have maximum exposures. Doctors, if they can, they will not be going into the room, because I understand they have many patients. So whatever they need to do, they will ask the nurse to do. PCAs, these are the people that help us. They also will ask us now to do the vitals, to draw the bloods, to do everything. Now, I don't mind, but I think at this point, nurses are feeling like we are getting the maximum exposure, because we are in these isolating rooms, which we're not supposed to spend that much time. We're basically there all day in our gowns, because, you know, things need to be done, and we can't not hold the patient's hand. I know some nurses have been saying that it's hard for them, but I double glove and I still go and hold my patient's hand when they're dying, because their family member's not here. And it's emotional, and it's only human to want to hold their hand, and while holding it, see that they've come down, that their oxygen has gone up, and that you feel like you've done your job because the medicine, unfortunately, at this point has failed them. So, not to sound too sad, I'm actually quite a positive person in life, but these past 2 weeks have definitely taken out all that I have had emotion-wise. I leave it at work, I come home, I replenish it by, after taking a shower, hugging my dog and kissing my husband. I just wanted to say for people to continue to remain human, to remain compassionate, that this too eventually shall pass, and what we have as an upper hand over this virus and over the situation is this ability to continue to be human, to continue to help each other. And I wish everybody a wonderful day. And please stay home, stay healthy, and be grateful for every little thing that you have.
This is Ruslana Lezichko from Ukraine and an excerpt from the Lord's Prayer, Our Father, Otche Nash.
Today is Wednesday, April the 8th. My name is Karen Aniel, and I'm part of the Toronto-based Canadian-Ukrainian band Zirka. And in my full-time career, I'm a nurse practitioner in geriatric medicine at one of the greater Toronto area hospitals. It's a beautiful, still morning in the country. It's 6 a.m., and I'm just out walking the dog and then off to work at the hospital. For the past 9 years, I've been working as a nurse practitioner in geriatric medicine as a consultant in both outpatient clinics and inpatient service. Never in my wildest imagination did I ever see myself serving during a pandemic. It's rather surreal. Just as in the outside world, things in the hospital are vastly different now. What was a place that was once bustling with activity is very eerily quiet. We're adapting to new routines. We can only park in certain designated areas or enter through certain access points while patients and their loved ones are diverted through a separate entrance. My day starts and ends being greeted by colleagues in full PPE screening us for any new symptoms. At work, we socially distance, each of us working from our respective offices, unless we need to go to the inpatient side. We've all left our business casual attire to be back in scrubs, which is something, those were days I thought were long over. Many non-essential outpatient services have been temporarily closed, with those staff redeployed to support other areas of the hospital as we prepare for a surge. But our geriatric clinics continue to be a vital service, and many of our patients are living in the community alone with frailty, placing them at higher risk for presenting to the hospital. And that is most certainly not a place that anybody wants to be right now, unless absolutely critical. It's been a challenge having to adapt to only providing consult support by telephone or OTN technology. It's just not the same, and I really miss the face-to-face interaction, the human connection, holding my patient's hands. Regardless, each patient and family member I've been able to continue supporting by phone has been tremendously grateful that we're still there for them and able to provide care in some capacity. On the inpatient side, all the teams have been working very hard to discharge patients back to the community with supports if it's safe to do so. The climate at the hospital is very tentative. We all feel it. It's uneasy. It feels as though this is the calm before the storm. It's like we're waiting for a tsunami to hit, but nobody knows for sure when that's going to happen. We're all hoping and praying that the community efforts to lock down and socially distance will lessen the impacts of this storm that we're about to weather so that we don't end up in a situation similar to other countries. For me, things were still surreal up until last week and over the weekend. So the nurse practitioners on my team were getting redeployed to take over the care of patients on the complex continuing care unit. And this is going to free up the hospitalists in event they get very busy with COVID patients while also keeping those care providers who are potentially caring for patients with COVID out of the hospital areas where there are no COVID patients. And it's been a difficult few days. It's Easter weekend. I wasn't able to visit my family like I'd planned. Everybody's birthday falls over this period of time, so we always have a big collective birthday celebration, and this year we won't. I miss them, and I miss contact with humans, and the uncertainty of when we will return to some degree of normalcy is really heart-wrenching. You know, it's hard to not get swept up in the wave of news and constant negative headlines. It's important to find positive perspectives and hope. People have really come to appreciate the littlest of things they took for granted lately. They have taken the time to express gratitude, which I believe is such an important, vital daily practice. I think humanity, for the most part, is stepping up and sending out a higher vibration of love to the world, to others, to strangers. There's greater respect for nature, for our Mother Earth. How humans are realizing the impacts that we've had on the planet. And this is all something our world really needs right now. And I just hope that this trend continues long after this pandemic has passed. I'll say one last thing, just because I'm in healthcare, I don't feel that I need any special recognition. We all have our jobs. This just happens to be the one that I signed up for. I truly believe that each and every person is on the front lines and that I'm on the back lines. We all have a duty to do our part on the front lines to help flatten the curve so that nobody needs to rely on the back lines. I wish for everyone to stay well and safe.
Once again, here's Toronto nurse practitioner Karen Aniel, this time with her band Zirka, singing her cover of the Leonard Cohen classic, Hallelujah.
Well, I heard there was a secret chord that David played and it pleased the Lord, but you don't really care for music, do you? And it goes like this: the fourth, the fifth, the minor fall, the major lift, the baffled king composing hallelujah, hallelujah.
My name is Catherine Hootsel. I am a first responder in a Northern Ontario community. I have been a police officer for 20 years. It's crazy to say, but crime doesn't even stop in a state of an emergency. We're taking extra precautions on the front lines to ensure everyone's safety. When people call the police for assistance or to report a crime, they are asked screening questions regarding COVID-19, if they've traveled or been exposed, or if they are symptomatic. And once we arrive on scene, we re-ask those questions to ensure a safe and healthy approach. Being on the front lines, there are constant changes to our situational awareness, and this is to ensure the health and safety of everyone. Again, we are all in this together, and staying healthy while working to protect our community, still having to enforce the law, is essential. We are fortunate in our northern community that we've got great partnerships. Our local university made and supplied the frontline workers with hand sanitizers. Last month in March, new legislation passed, and we are to educate everyone, especially when there's gatherings of more than 5 people that are non-family members, to ensure we are all taking the necessary safety precautions to help slow down this pandemic. And we are doing our part to adapt to social distancing lifestyle, even in our workplace. Remember, everyone, we must be responsible, we must be kind and patient during this pandemic.
By the way, it is Police Constable Catherine Hutzel who is playing saxophone with her band Zirka on this song.
Maybe there's a God above, but all I've ever learned from love is how to shoot somebody who outdrew you. Then it's not a cry that you hear at night. It's not someone who's seen the light. It's a cold, it's a broken hallelujah, 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 hallelujah.
my name is Paul Semenuk. I'm a firefighter here in Edmonton, Alberta. We've brought on a huge onslaught of extra protective equipment when going to emergencies. We've looked at different strategies to decontaminate our rigs after each call to really protect ourselves from the spread. We go to many calls throughout the day, and you never know when you're going to encounter it. So it was important for me to really look at the ways this virus can spread. So I didn't bring it home with me at the end of the day. I have 3 young children and a wife at home, and I didn't want to jeopardize their health. Coming home, looking at the different strategies that I've discovered about myself personally, really focusing a lot of the attention around keeping our kids happy throughout the day. I mean, this self-isolation is hard. Hot Wheels. I remember playing with Hot Wheels as a kid, and we built Hot Wheels tracks throughout our house now, and it's a lot of fun playing with them. It kind of humbled me in a little way to find the importance of being a dad. Truly, and sharing some of the things about me to my children instead of sharing the teachable lessons. It's not always about that. So I've really discovered that about myself, and that's been a fun discovery. When it comes to society and how the impact is ramping everybody's emotions and the stress levels and anxieties are going up, I think that it's important that we collectively come together and stay humble. We rely a lot more on our abilities as a society to band together. We don't take things too personally and selfishly. So we have to look at some of the other people that are struggling in more severe ways than what I do. I have a strong ability to cope with what's going on, and I feel that helping others right now is important too. So as far as being a frontline first responder during the pandemic, it's relying on the people around you to keep you grounded and to keep you supported. And those are definitely a lot of the things that I've discovered because of this.
Hi, my name is Natalia, and I'm a registered nurse. I work in endoscopy unit of Etobicoke General Hospital. Our routine is definitely changed for our specific units. All elective procedures have been cancelled or temporarily postponed, I would say, and only open for emergency cases. It's unusual, as we used to do. It's a fast-paced clinic, and we used to do over 40 procedures a day in an 8-hour shift. Now we only open for the urgent cases. The whole routine changed. Before even coming to the hospital, we have to get every morning, fill up the form from occupational health in order to get the pass that we are able to work that day. You know what? We are here to do what we have to do as nurses. All urgent procedures are done in a negative pressure room. If it's AGMP, it's aerosol-generated medical procedure. Gastroscopy right now not considered that type of the procedure, but we're still doing it in a negative pressure room because you never know. There's not enough data that this is only the contact droplet precaution needed to be done. It has been stressful, I can tell you that. Half of our nurses have been redeployed to different departments in need. There's only 4 of us at this point, and there's always 2 nurses on call after hours. That means that right now there's only 4 of us, and every 2 weeks I am on call. It's been 4th week we're doing this, and it's hard, but there's nothing we can do. We have to beat this virus, and I do believe that everybody can help us by staying at home. I think we'll come out of this much stronger than ever. I believe the whole world will change for better. No matter what, we will beat this virus.
This is violinist Vasil Popadyuk, the band Papa Duke, with Tall Blonde Man with One Black Shoe. In Vancouver, horns from passing cars, noisemakers from apartment balconies, And the people who are blowing and rattling these all are saying thank you to healthcare workers who are fighting this pandemic round the clock. Tamara Navarrete grew up in London, Ontario. Today, she is an ER nurse in one of British Columbia's largest hospitals.
My name is Tamara, and I am a nurse in Vancouver. I've been working as a nurse for about 8 years now. This pandemic has really changed and affected our everyday work and practice. One of the greatest things I've seen so far is how much the community has come together to not only support frontline workers, but also each other. I think the best thing that we can do right now is just try to take care of ourselves and stay home the best we can.
Today's Wednesday, April 15th, and I'm on my way into work for my 12-hour shift. So it's been about 2.5 weeks since my symptoms appeared, and according to CDC guidelines, I'm now recovered, and I'm safe to return to work to the best of their knowledge. I would say my body's operating at about 85% full strength, so I'm very careful to get enough rest and to have good nutrition and not to overdo it. On a positive note, during the course of this illness, I did lose 10 pounds. So upon my return at work, on my first night, we had 20 dispatches for emergency calls for service. I would say about 85% of them were related to COVID patients or patients exhibiting COVID-like symptoms. Not all in a very severe state, but COVID nonetheless. I was told this was a slow night because the previous week, while I was still out, in one 12-hour shift, the crew had 37 dispatches from the same station. I couldn't even imagine that. So this has taught me a couple of things, this episode of illness. In comparison to what a lot of other people go through, really wasn't that crazy for me. Others have much more serious illnesses, last much longer, require much more complex care than I did. But I've learned that it's important. The people around you, the people closest to you, are very important, and never to take them lightly, because they are your support system, whether it be your family, your neighbors. And also made me think a bit about life and how fragile it truly is, how quickly things can be turned totally around in such a way that you may never have anticipated it. It's important not to put off those things that are important to you, and it's important not to put off those people that are important to you. I hope in a few months all of this is behind us and we can start living a normal, joyful life once again.
You're listening to Evan Wish playing his composition Forget Me Not Blue. I'd like to gratefully acknowledge that partial funding for Nasha Kasha is provided by the Shevchenko Foundation and the Ukrainian Credit Union. До милої зустрічі за тиждень часу, дорогі слухачі.